everyone. I am Shakel Bob. I am a former Miss Pitani, a former Miss Rural SVG and Miss SVG contestant and runner-up. I'm a lawyer by profession, but a pageant lover at heart. Do not let the negatives prey on your mind, because a stitch in time saves 9. So, it's COVID vaccination time. Get vaccinated today to reduce the impact of COVID-19 in St. Vincent and the Grenadines.
And I urge you, get vaccinated. It is safe and it is effective. Stop the spread, help the fight, and make the difference that's right. And let us unite and do the thing right.
Good evening and welcome to another edition of Round Table Talk. Of course, the talk is once again COVID-19 and what's happening here in St. Vincent and the Grenadines. The situation continues to change rapidly. We are pleased that you could join us. With us this evening, the CMO, Dr. Simone Kieser-Beach, and we also have Dr. Rohan Dishang, consultant urologist. Good evening, Dr. Kieser-Beach. We want to start with you.
Good evening.
Okay, tell us what's happening. What's the situation?
Okay, in St. Vincent right now, we have dealing with the second big spike, and we announced that we had 28 new cases. That was on Sunday. Typically, Sundays tend to be very light. So we had 28 new cases with a positivity of 17.3%. We now have 3,866 total COVID-19 cases reported in St. Vincent since March 2020, the 11th, of which 1,304 persons are active cases. And 2,529 persons have had negative tests. And we typically say that's recovered, but we need to understand that that's just somebody who has had a negative test, but might actually continue to have symptoms or side effects or complications of COVID, such as long COVID. So that's where we are now. We have unfortunately recorded 33 persons who have died from COVID, mainly COVID pneumonias. And in the last September, just in September and into October, we went from 12 deaths up to 33 deaths. So a significant number of persons have died from COVID.
Okay, so we have 21 deaths within the last several weeks. Let's talk a little bit about the demographics of the people who are now being affected by COVID and by COVID-19 deaths.
Okay, so all of our deaths have been persons who have been unvaccinated. One person of the latest group, one person is reported to have had one vaccine. So still unvaccinated, and that one dose was recent. Very worrying is that we have had some persons outside of what would be the typical person who would die. So early on this year, when we had deaths, there were persons who were older and persons with many other illnesses like diabetes, hypertension, renal disease. But we have had some very young persons with no comorbidities. Our youngest death is somebody who's 27 years old. And this is what we are seeing. It is extremely worrying. The majority of our patients are admitted. So right now in hospital, we have 58 persons admitted, of which we have 2 of them being partially vaccinated and the others unvaccinated. This is according to our records that we have. We are seeing younger persons, I say, in terms of those persons turning up positive, persons in the workplaces, persons at homes, entire families in the households, the majority of them being unvaccinated. We do have persons who are vaccinated, both partially and fully vaccinated, being coming down with COVID-19, but the majority of those persons have very mild diseases, they don't need admission and they recover pretty well. So the disease, the outbreak, just as it is in other countries right now, is mainly an outbreak of the unvaccinated persons.
Okay, Dr. Deshang, I know that you're a very strong advocate of COVID-19 vaccines. What is your take on what is happening in this country at the moment in regards to the disease?
The simplest word is unfortunate. Unfortunate because we've had a lot of time to, as my Facebook friends would say, do our research. We've had a lot of time to ask questions, to be skeptical. And it's unfortunate. I made a post on Facebook a few days ago and said there was no need for Vincentians to be dying in the presence of an effective vaccine.
It's actually a quotation that I have here from you. Yeah.
There is no need for us to be dying. And that's why I said it's unfortunate. It's so unfortunate that when I think about it, it makes me angry, so I tend not to want to talk about it. Because it tells us the power of words, the power of misinformation. And there are even those who are doubling down and trying to misrepresent what's going on. There are those who are saying, oh, we have escalated the figures to make people frightened. If anything, I mean, my CMO would agree with me, we tend not to escalate the figures. We have a fairly high threshold for calling a death a COVID death, to the point that sometimes I think we put the bar too high. And so it's facetious that people will think that we are elevating the numbers just to make persons frightened to go to get vaccinated. And then you hear the other flip side of the coin. Trust me, people take the information and misinterpret it in whichever way they can, including even the information about the vaccine. You hear, this is because the vaccinated are spreading it. The vaccinated get the infection, they're asymptomatic, and they're therefore spreading it. Those are the two most common things. That we're elevating the figures just to get people frightened. That's not really what's happening. And we have to blame those who are vaccinated, because if because they're vaccinated, they're getting the infections, they're spreading it, and people not knowing, and we're not testing them. We should be testing them. Every scenario you can think of being used to even distort the reality of what's happening, and that's sad. Fortunately, the people are waking up and saying, you know what, I'm going to get vaccinated. And I bet you, if you go at the clinics now, there are long lines outside the clinic for people waiting to be both tested and vaccinated. I have a lot of patients come and asking me, now, doc, can I be tested? Up to today, I had two. One colleague of mine said, look, I have some issues. I'm seeing my specialist. I'm going to get tested, hopefully get vaccinated soon.
Saturations, you've heard about that. That's the amount of oxygen that's circulating in the blood. They come in very ill and they deteriorate very quickly. And so we are really asking persons that even if you have a little runny nose, you have a little cough, you get checked to make sure this is what it is. And even while you're at home, especially persons with pre-existing conditions, if you would notice at any point that, you are vomiting or you have diarrhea that's not settling, you're feeling suddenly much worse, we ask that you seek urgent care. But the nature of COVID is that it is, and this is something that's been reported repeatedly, that persons can go from stable to completely unstable and die in a very short space of time.
So it's not a question really of whether or not you seek care early, because you could be without symptoms, say this morning, and develop symptoms later on that same day.
Some people it's partially genetic, because the virus attaches to a certain cell in the lung, and how it attaches varies. Some people have receptors that are more susceptible, almost sticky. the virus attaches quicker. And when the virus attaches, it creates a change in the body. We call it a cytokine storm. Basically, it just means the body reacts violently. Okay? The lungs shut down, they get wet, soggy, shut down fairly quickly. In a matter of hours, you're here today and you're gone tomorrow. It's more likely to happen in elderly persons with pre-existing conditions, but there's some young people it happens to, and that is the frightening thing about COVID, because we used to think, as Dr. Keys would tell you, oh, it's just elderly persons, but we've seen, as she said, the demographics change. We're seeing younger persons, okay? And we were talking about this issue of we having a high threshold for diagnosis. As Dr. Keys has said, not because if you've had the infection and you have recovered from the infection, meaning your test is negative, it doesn't mean you have recovered from the effects of the virus. Okay. We know that you can have recovered from a nasal swab, but in the tissues the virus is still present. And you can have long COVID, meaning even if the virus is out, meaning the body has gotten rid of it, that fight in the body to get rid of the virus creates a situation the body has to recover. And you can get tired, worn, brain fog. A lot of symptoms follow for weeks and months after. But let's go back to the other scenario where you get the infection, you got a negative test, you recovered, but the virus might still be in your tissues. And a few people, I suspect, might have died with so-called negative tests. So our figures are conservative, and rightly so, because we don't want to elevate and create fear unnecessarily. But I can imagine a scenario where people have died, and first of all, maybe at home without having a test before. I know you've heard people who found there, you know, is that we don't know this and we don't know that, and the vaccine isn't perfect and it isn't. And I said to you, just like the disease, the vaccine itself and its application is evolving. It's getting better. We came in with a vaccine that was fairly effective. We applied it broadly, and with time, we are fine-tuning it. You know, and I said, I use the word evolution because it's the same thing with the disease. Our knowledge of the disease is evolving. Okay? We know some basics, but it's so unpredictable that I wouldn't take any chances. I'm not going to say, well, my immune system is strong, therefore I don't need vaccination. Not taking that chance. As Dr. Keys just said, we've seen young persons, someone as young as 27. We've had a few 40s succumb to it. You know, your colleague from NBC Radio, she was in her 60s or 70s. She was young. You know, we've had 40-year-olds. We have 42, 44s. We've had 2 or 3 in their 20s, as Dr. Keys will tell you. So you see, it's not just the 70s and the 80s. It's fairly young, strong people with what we would consider good immune systems. And a lot of our younger men in their 40s have undiagnosed preconditions. A lot of our men are alcoholics, obese, hypertension, undiagnosed, especially hypertension. Diabetes you can pick up fairly quickly, but hypertension go on for years, and then they have big hearts, which are not necessarily strong but weak. And when they get COVID, they succumb because the effect on the system is so drastic that the heart itself gives out. So it's not as simple as people think. It's not that simple. It's not what you think. You're not as strong as you think you are.
Okay, and the whole question of people saying that if they get the disease, they can develop their own immunity. Mm-hmm. How practical is that, and how true is that?
It is true, but it's a high price to pay. Some people have waited too late, waiting to get the infection or saying things, I won't get it, or if I do get it, I'll recover from it because I'm strong, my immune system is good, and succumb. That's why I just said it's so unpredictable. We can tell generally the people who tend to get over it, But with the Delta variant, we've been knocked off our feet. We were so surprised, so caught off guard that we knew it could have happened. But we've always had this kind of false sense of security that, no, it's just old people. In that kind of attitude. And then when we start seeing the younger persons die, it's the 20s, 30s, 40s, the vast majority, I would suspect, asked Dr. Keys about the half of those who've died in the last month has been between like 40, below 50, about half of them. And that is troubling.
Yes, it is. I want to understand something as well. Somebody has recovered, quote unquote, meaning that it's not showing up in their system per se. But is it still likely that they can infect someone?
No, infection takes place by aerosol transmission. Okay, it's possible, but it's unlikely because you have to be coughing or speaking and so on. It comes from the mucous membranes, and it can be absent in the mucous membrane. You dig your nose, it's not there. Dig your teeth, mouth, things like that's not there. It's not on the skin, but it could be in the liver or the lungs or not the lungs necessarily, the tissues, in which case you'd be really sick, but it could be in the liver or the kidneys or somewhere else and not, be shedding the virus. And therefore, there's a period of time, even after your test is negative, that you should be careful. Okay. That's why everybody should be wearing masks. When I got vaccinated, I think there was this common thing about me oh, he's not wearing any mask now. And I still don't wear mask in my house. I have him open, in the street, no one around me. But once I get into a place or I start conversating, I put my mask on. I do it because I just want the sun. I just want something just to feel the sun. But I am so aware now. I'm in the office, I have my mask on. Any enclosed space, I have my mask on. Home is the only place I maybe don't have my mask. Because even after a lot of infections are asymptomatic. 40 to 50%. In other words, 4 to 5 in every 10 persons. Especially if you're a younger type person, it can be asymptomatic.
We'll talk some more about that when we come back after this break. Back in just a moment.
This evening on the VC3 News Update, e-litigation portal for the High Court to be launched later this month. Early medical care should be sought once exhibiting symptoms of COVID-19, according to Chief Medical Officer Dr. Simone Kiza Beach. And fiscal difficulties could force government to axe social and capital programs. Join us at 7 p.m. for these stories and more on the VC3 News Update.
I am Hans John, the 2019 Vinci Ragasoka Muna. I took the COVID-19 vaccine and so should you. Let's be an example to others. Get vaccinated today and help control the spread of COVID-19.
Vaccinate if you want to eliminate the spread of the virus in our place, and do not procrastinate, but rather let us vaccinate. Get vaccinated today.
Welcome back. We were talking about asymptomatic and symptomatic when we took the last break. One of the things you also spoke about is the fact that the threshold for diagnosis is too high. Can you care to explain what you mean by
The
that?
diagnosis of death. I think in our country, I mean, I'm being a devil's advocate. I'm one of those who believe that if you were diagnosed with COVID and you came into the hospital and you had a heart attack, okay? You had your fever, your chills, rigors, little rattles on your chest, you came down very badly with it, but you known hypertensive or diabetic, and then you had a heart attack and died. And many would say, oh, because the pressure was high or the sugar was high. I'm one of those who said no. The precipitant of your heart attack was the bad infection from COVID. You know? But I think, I mean, Dr. Keyser can confirm it. We have strict criteria for saying, and when you do medical certificates, we generally have strict criteria for diagnosing certain things and for labeling a disease as the cause, the direct cause of death. And I think with COVID, we are fairly rigid, you know, so rigid that I think we are, in my opinion, you know, underestimating the deaths. We are being very conservative. We are trying not to frighten people, and then we're still getting blamed for elevating the figures to frighten people. I wish we had. I always think we should, but here we are. We're being blamed for what we are not doing.
All right. Need to apologize. I was just told that our conversation during the break was on air. Hope that we didn't say anything that, we didn't have anything confidential to disclose there. We're sorry for that. Someone is asking, when a person is tested positive for COVID, what is the typical treatment? We keep hearing of oxygen, but is there any medication? Dr. Keyser Beach, you probably want to start, yeah?
Okay, my non-clinician is. Okay, so the treatment generally is steroids, dexamethasone, azithromycin, along with oxygen. And then, depending on what else is going on with the person, those other illnesses, those other diseases, those other disorders are managed. So, for example, we know that COVID affects the pancreas, can affect the pancreas and result in uncontrolled diabetes. So the treatment would also be the management of the diabetes and all of the other things. The need to increase your oxygenation, that would be with the oxygen, but also with the other medication that's given. Currently, we do not have monoclonal antibody here. We are seeking to acquire some, but as you know, with most of these things, there are strict restrictions in terms of the exportation of some of these drugs. So that's basically what we're doing. You're supporting the oxygenation in terms, that is the amount of oxygen you're giving the patient, along with using the steroids, the dexamethasone, to decrease some of that, what, as Dr. Duchamp described, that sort of extreme response. So we are using what is recommended in our patients. I wanted to just make a quick comment on something. One, as I mentioned earlier, it is reported that one of the persons who died had recently had a vaccine, and not sure if this is what it was, but we are seeing this where some persons, they realize they might have been exposed and they run quickly to get the vaccine. I want to remind persons, you know, you don't want to wait until you have been exposed, because you have to have first dose and then a second dose. Typically that second dose, the earliest is 3 weeks if you're dealing with the Pfizer or the Sputnik. And then you have to have 2 weeks after that before you have your maximum amount of protection. Okay, so we are encouraging persons not to wait until the person next to you in the office test positive and then you run off to get your vaccine. We want you to go and get it now. We are seeing the benefits. Today, we had a 74-year-old female who was on the ward for 2 weeks, COVID positive, and she's been discharged today. And she's vaccinated, she's fully vaccinated, and she's going home and she's well. And you know the difference between a 74-year-old, who we know is a high risk for a poor outcome relative to somebody who is much younger, 47, say, And the difference there, a significant difference, proven by evidence throughout the world over time, is the vaccination. That's one of the things. So we really encourage persons to go ahead and take your vaccine as soon as possible. And we have a wide range of vaccines available. And even if you have a contraindication to one type, you can have the other. Just wanted to say that up front.
Follow-up question. If someone has been exposed and is diagnosed COVID positive, but they have had that first dose, yeah? In terms of they're getting better, how soon after that would they be able to take the second dose, or do they have to start over the entire process?
No, they don't start over. You can take up to as early as 1 month after your negative result. You can take it, but the advice varies. Some persons will say 1 month after the positive result. Some persons say 1 month after the negative result. And I know there's some physicians who have given, as soon as somebody has a negative result, you get your second dose, or you go ahead if it's first, you get your first dose. I just received early this morning, received an article from a colleague and reminding persons about the evidence which supports the fact that even if you have been infected, the immunity that you get from that infection is inconsistent. So I might have a very good response. I might have a very poor response. And also the antibodies that you produce coming out of an infection, they don't last that long. Okay, so the advice is that even though you have been infected, you really, really need to go ahead and get your vaccination.
Okay. And in terms of a recovery rate, is there any difference between someone who is vaccinated as opposed to someone who is unvaccinated? Or the recovery is the same?
No. The recovery rate for those who are vaccinated is significantly higher than those who aren't. The risk of complications are also significantly less if you're vaccinated compared to if you're not vaccinated. Most of what we've learned about COVID in terms of the long COVID and all the symptoms are from people who were not vaccinated, who got the infection, who survived to tell the story, and those are the people we study to tell you what to expect if you get the infection. People who are vaccinated can have symptoms, but they're generally milder. Honestly, they're generally milder. A cough, a cold, a sniffle, and that's why they blame those of us who are vaccinated for transmitting or creating this surge, because we are less likely to succumb to it in terms of very bad infection, being hospitalized, and extremely rare you might die, especially if you're severely immunocompromised. So it tells you the story is there, the figures are there, and it's repeated country by country, millions by millions, that if you're vaccinated, you fare significantly better in terms of symptoms, in terms of sickness, in terms of hospitalizations, in terms of need for oxygen, in terms of hypoxia and ventilation, and eventually death. You fare significantly better, infinitely better. And I always wonder, why would you want to increase, even if you don't die from the infection, okay, the 50 to 60% of persons who are not vaccinated but who do get symptoms, just the symptoms, the cough, the aches, the pains, the fever, the flu, curl up in bed, loss of appetite, the loss of desire for, the loss of taste, the loss of smell, and if you have difficulty breathing, a lot of people will get slightly hypoxic and not need oxygen. Just the fright of knowing that this can progress, it's frightening, I mean, most of them will eventually recover, but the 5% or 10% that eventually gets admitted to the hospital, or the 1 or 2% who out of that who die. I mean, why do you want to go down that road? You have a 50 to 60% chance, if you're unvaccinated, that you'll get the infection and have some problem. Most of it will be mild, but even the mild symptoms such as cough or cold and fever is worse than the most common side effect of getting vaccinated, which is usually an ague. Most people are asymptomatic. In about 4 in 10, they will have ague, chills, rigors, and that settles fairly quickly with paracetamol. Rarely would you need to use something like Advil, but generally just paracetamol. And that's generally it. So why do you want to exchange a mild reaction from being vaccinated to a fairly bad cough and cold and fever? You know what I mean? For a few days, there is no comparison. I would take my injection. I had in my first dose a mild fever. I got up the morning, early 2 o'clock that morning, and I had a little chill, took the paracetamol, it was over. My second dose, I didn't want that. I didn't wait for it, so I pre-dosed with paracetamol, and I was fine. Yeah.
Okay. When we come back, we are going to talk about how do those people who are not hospitalized but are rather isolating at home, how are they taking care of themselves and getting better? More when we come back.
Band of the Year winner 2019. I'm urging you to practice proper hand washing to curb the spread of COVID-19. When you're able to wash your hands, use soap and water to clean your hands thoroughly. Get vaccinated today. Protect yourself and be responsible.
To me, and I urge you, get vaccinated. It is safe and it is effective. Stop the spread, help the fight, and make the choice that is right. And let us unite and do the thing right. Man and woman, let us join in the fight.
This evening on the VC3 News Update, e-litigation portal for the High Court to be launched later this month. Early medical care should be sought once exhibiting symptoms of COVID-19, according to Chief Medical Officer Dr. Simone Keyser-Beach. And fiscal difficulties could force government to axe social and capital programs. Join us at 7 p.m. for these stories and more on the VC3 News Update.
You don't want to... Welcome back. Before we took our final break, wanted to talk about what do people at home who are isolating at home, are unwell, have been diagnosed, what did they do at home to get better, because not everybody can be admitted to the hospital, and what determines whether a person is hospitalized or not. Dr. Keyser-Beach, I'll take you first on that, and then Dr. Rohan can come in.
Okay, so remember we're dealing with a virus, so that the treatment for viruses is generally antivirals. And recently it was announced that Merck had developed an antiviral, but obviously that's not even available, I think, for general use, much less is in Vincent. So as with any other virus, it's mainly at home, it's what we call symptomatic care. So we encourage persons to stay hydrated, meaning you drink your fluids. You also can use something for the fever, which would be paracetamol. We prefer that you use paracetamol generally because anything like the ibuprofen, the NSAIDs might affect your stomach, especially if you're not eating or so. So we prefer that you use the paracetamol. Rest, fluids. Some persons have used inhalations to try to clear, if they're congested, to clear their nasal passages. So you might use steam inhalations. You might want to add some of the eucalyptus, some oils and stuff like that. But it's mainly symptomatic. Rest is extremely important because remember, COVID affects your lungs and affects the amount of oxygen you're getting into your lungs. So if you go and start jumping up and down and exercising, you're putting more stress on your lungs and your heart. So you don't really want to do that. Definitely you want to stay, exercise moderately, mildly, take little walks around the house, not beyond your home. You get some sunlight, you try to eat a healthy diet, you keep your fruits up, and fluids and paracetamol for the pain, a decongestant, if anything, to help you with the stuffiness, nasal congestion, the cough. But in terms of any more specific treatment, that is not what is available or required at this time. So, and we spoke about what happens. So somebody turns up at the emergency department and we determine whether or not that person is going to go home or that person is going to be admitted. And it's because of whether their oxygen saturation, as we always talk about, if that is already low, or if it's somebody who has pre-existing conditions, somebody who's asthmatic, somebody who's a diabetic, and these are things which would deteriorate, which would get worse. And we determine that that person is not suitable to go home, but must be admitted because of how ill they are or the potential for their current state to deteriorate significantly. So that person is going to be admitted if in that case. So the determination is generally made by the persons in the emergency rooms. And sometimes we get calls from persons in their homes, and from their description, we bring them in and they are admitted as necessary.
Yeah, well, for people at home, they also do other things. I advise them to sit in the porch and get some sun. If you live alone, go in the yard, get some sun. Vitamins C and D. C helps to fight infections generally. It's a non-specific anti-inflammatory, and so is D. D has been proven to boost the immune system and help people to recover from COVID specifically, viral infections generally, COVID specifically. And those who have a bad cough but whose oxygen levels are good, some doctors will give them azithromycin, as you've heard Dr. Keyser said, and tell them go home and use their mist, etc. And some will give them antitussives, that is something for coughing, because the cough can be terrible. And non-steroidals we don't advise, but sometimes it can be very bad. Chest pain, because when you cough a lot you get pain in the chest, and some doctors, once you're eating, will give you non-steroidals. They would monitor your blood count, because sometimes your platelets can drop and non-steroidal can make it worse and cause it to bleed. So we tend to say Tylenol or paracetamol, as Dr. Keyser was saying, but the other adjuncts, the sunshine, the vitamin C, the vitamin D, and those whom the doctor D might need some azithromycin to take home. I've had a nephew-in-law, my niece's husband. He's in Grenada. He's asthmatic, and so is my sister. And she didn't get COVID. She actually got COVID, but she was fairly well. But he was very bad, and his doctor gave him zinc, azithromycin, a couple of courses, and along with his vitamins, etc. So there are things, the good things that most people who are at home isolated are asymptomatic. We're talking about the symptomatics who are not hypoxic. In other words, the oxygen levels are fairly good, and send them home, and you give them instructions. If it gets worse, if you find it's difficult to breathe, you get tightness in the chest, okay, then you need to get back to us. But for those who are asymptomatic, or those who are light cough or cold, etc., aches and pains, blood oxygen levels go, they can go home and be treated at home, because we really don't have the capacity to treat everyone in hospital. We keep but the sickest in hospital. Yeah.
Okay. 33 deaths are a lot in by any standard, by any measure. But if we look at our neighbors around us, Grenada, St. Lucia, we notice that they have had a significant amount of deaths more than we have so far. What do you think is aiding us in this respect, and we have not, at least for now, gotten to those kinds of numbers?
I just think it's we've just been fortunate, if you want to call it that. And as you've heard me say, I don't know if Simon would agree with me, that's Dr. Keys, I just think we have a fairly high threshold for diagnosis of death as a COVID death. We want to be convinced, quote unquote, that this is, so we have strict criteria. I think I don't want to dispute their figures in keeping about their infections, but for us, I think the anomaly is because I suspect our threshold for calling it a COVID death is higher than theirs. That could be one. It's just so we can just be fortunate in that we don't have a lot of deaths. We have not had a surge as they've had. Our surge has just come, and we don't know what to expect. They've had 3 or 4 surges. We had this trickle effect coming through. They've had surges, damped down, another surge, damped down, they've locked down, etc., etc. So their figures came like 20 at a time, 20 at a time, 20 at a time. We've just had a big 2021 at one time. We don't know if there are other surges to come, and we haven't seen the end of ours, so we don't know how much more deaths will come. So let's keep our fingers crossed. Remember our figures? Initially it was so below everyone else's, and then last year Christmas just had a big surge of 1,500, and then it lowered down again, and then here we are 6 months later with another big surge. Other countries are having surges like every month or 2. We've had 6 months with no surge, and suddenly we have a massive surge and death. So let's not be too optimistic. We always pride ourselves in thinking, oh, we are God's children, we don't get any catastrophes, don't worry, and then suddenly here we are. Our initial optimism, we're not going to get there, no, nobody's going to die. We only have 10, and now we have 33.
Dr. Keza Beach, I know the system has got to be overwhelmed. How is the system coping, and how do you envisage, say, the next week or so is going to be where COVID is concerned?
Okay, so as Rohan pointed out, sorry, Dr. Bishop pointed out, is my senior. As he pointed out, our surge, the second surge, started around the 8th of September. And at that time, we started seeing the cases, but we were aware and we had been warning, because this is what epidemiology is. This is what, you look at what's happening around your neighbors. And even though we are a praying country, these are all of us, we are all praying countries. So look at what happened in Grenada. Grenada started out in August with having had 2 deaths since January this year, and they're now over 100. And you say we haven't had as many, but because we haven't reached that spike as yet, and we are heading up there. Okay, so, and Grenada also has a much higher, compared with us, level of vaccination. So they had a much more protected population than we have. So we are looking, and we are looking at these figures with great concern, because already, as you said, we are looking at our hospital where we have had to utilize 2 wards, so we have already, fully occupied our Argyle isolation facility. Then we had to move into the Milton Kate Memorial Hospital, take over the female medical ward, take over the pediatric ward, and we are now looking at moving to a 3rd ward at the MCMH, because we are seeing more and more cases coming in, needing more and more care. And that's a significant blow to our capacity to offer other types of care. So we're really concerned about that. I am looking at the figures daily, looking at the amount of testing, the contact tracing that's going on, and I'm not seeing at this point any sign that we are flattening the curve. Rather, it's an exponential. And we know that as we do that exponential rise, as happened in Grenada, even look at Barbados. Barbados was pretty fine for quite a while, and now they have gone right back up. You're seeing deaths again. So I'm going to say that we are very concerned. We urge the vaccination. We ask persons to really use your mask. We're dealing with Delta, Gamma, and Mu. So you should be using your double mask. Even your vaccinated persons, we should be double masked. We should be using properly fitted masks, and we should be seriously looking at if we are using cloth masks, those should be doubled, or we should be using N95 masks, so we are even more protected than before. That's the only way we're going to cut this. We have to be masked, we have to be distanced, we have to be sanitized, and we have to be vaccinated.
Well, that's the perfect note on which to end this evening's edition of Round Table Talk. Thank you so very much, CMO Dr. Kiza Beach and also Dr. Rohan Dishong for being at the round table this evening. Vaccinate, vaccinate, vaccinate. That's the message this evening. Have a pleasant Wednesday. So long.